So I think when a patient comes to see us, the simplest screening is of course a clinical examination and history that's taken from the patient. And from there, we can assess how many risk factors the patient has, and we create a general risk profile for that patient in particular. Once that is done, then we will have to decide what needs to be done next. And I guess the next simplest test in the office will be a bedside ECG, or what we call electrocardiogram. What the ECG does is to take an electrical picture of the heart, and from this ECG we can see many things. We assess the heart rhythm, we assess the electrical stability of the heart, and in some patients we may even be able to see if there's underlying heart artery blockages or previous heart attacks. So that being done, we can then that takes us one step further into the assessment for a patient, and screening is a very cheap test. Then subsequently, what we can do is, again in the office, we do a treadmill stress test for patients who have some chest discomfort, but we're not really sure whether it is the pain is due to blockages in the arteries. A treadmill stress test is the same ECG test, except now the patient is running on the treadmill to stress the heart, to make it beat harder and pump faster, and then we see if there's any indication of any underlying blockage that may not be detectable on the resting ECG. Another test that's very useful in the clinic is to do a heart ultrasound, what we call echocardiogram. And this is an ultrasound just as we do it for the obstetrics, where we ultrasound scan the babies. And what it looks at is the heart function. We can look at how strong the heart pump is, whether it's normal, how thick or is there anything abnormal with the heart muscle, and also assess the valves. There are 4 valves in the heart, and only with the ultrasound can we really assess these valves in more detail. So once that is all done, we also do a general assessment for the patient in terms of whether he has pre-existing diabetes, high blood pressure and cholesterol, and those are of course with blood tests, especially with the diabetes and cholesterol. And then we try our best to manage those and then bring the entire patient's risk profile into assessment and control some of these risk factors.